Welcome back, everyone, to the deep dive. Ready to dive into something really important today?
Absolutely.
Today, we're tackling ischemic stroke.
Definitely a topic that deserves our attention.
So let's just jump right in. What is a stroke exactly? For those who may not know.
So in the simplest terms, a stroke happens when the blood supply to a part of your brain is disrupted.
Okay.
It's kind of like if you imagine a highway and there's a sudden blockage.
Mm-hmm.
That traffic, which in this case is oxygen and all those essential nutrients,
Right.
it can't get through.
Ah,
And this blockage causes damage to those precious brain cells.
that makes sense. And there are different types of strokes, right?
Yeah, absolutely.
Right.
We're zeroing in on ischemic stroke today,
Okay.
which is the most common culprit.
Mm-hmm.
And this one's caused by a blood clot blocking an artery in the brain.
So it's like a clog in the pipe.
Exactly. You got it.
Okay, so that blood clot, it acts like a roadblock, essentially cutting off those vital supplies to the brain. There are two main ways these clots actually form.
Right.
Can you sort of break that down for us?
Absolutely. So think about your plumbing system at home.
Okay.
One way a clot can form is like that rust that builds up inside a pipe over time.
Okay.
That's what we call thrombosis.
Uh-huh.
So the clot, it forms right there in the blood vessel in the brain.
So the problem originates like in the brain's plumbing system itself.
Exactly.
What about the other way?
Okay, so now imagine a piece of debris
Okay.
breaking loose from your water tank and traveling down the pipe until it gets stuck,
Oh,
blocking the flow.
I see.
That's similar to an embolism.
Okay.
A clot forms somewhere else in the body,
Mhm.
often in the heart,
Okay.
and travels to the brain
Uh-huh.
where it lodges and causes that blockage.
Two different scenarios.
Right.
But they both lead to the same critical issues. A blocked artery and a brain deprived of what it needs to function.
Exactly. That's the key takeaway.
Now, is there any other way for an ischemic stroke to occur besides those two?
Yeah, there's a less common type called systemic hypoperfusion,
Okay.
where low blood pressure may be due to heart failure.
Mm-hmm.
It reduces blood flow to the entire brain,
The entire brain.
the whole thing.
So, what puts someone at risk for this type of stroke? Are we all just rolling the dice, or are there things that we can actually control?
Well, some factors like age and family history,
Mm-hmm.
those are sadly out of our hands.
Yeah.
But the good news is many risk factors are modifiable,
Okay.
meaning we can take charge.
That's encouraging.
It is.
So what are some of these things that we can control?
The big culprits are high blood pressure, high cholesterol, diabetes, smoking.
Wow, that's a lot.
It is a heart rhythm problem called atrial fibrillation.
Right.
All of these can damage blood vessels over time, making them more prone to clots.
Now, high blood pressure seems to be a recurring theme in so many different health problems.
It really is.
What makes it such a threat in this particular case with ischemic stroke?
Well, you got to think of those tiny blood vessels deep in your brain,
Okay.
like delicate pipes.
Mm.
High blood pressure puts constant stress on them.
Okay.
It's damaging their walls and making blockages more likely.
Like a ticking time bomb.
It really is. So managing these conditions is crucial for stroke prevention.
Absolutely. So what happens at the cellular level when a stroke actually occurs?
That's where it gets really interesting.
I bet.
When blood flow to a brain region is blocked, it triggers a cascade of harmful events.
Okay.
It's almost like a domino effect.
So walk me through this domino effect. What happens to the brain cells when they're suddenly cut off from their supply line?
They essentially start to malfunction.
Okay.
Potassium leaks out. Calcium floods in disrupting that delicate balance inside.
Oh.
The lack of oxygen also leads to harmful free radicals
Wow.
that damage cell membranes,
Okay.
like little attackers wreaking havoc.
So it's a multi-pronged attack on those brain cells.
Yeah.
Now, I also read about this thing called the ischemic penumbra.
Right.
What's that all about?
So the ischemic penumbra
Yeah.
was a fascinating concept. It's that zone of brain tissue around the core area of damage
Okay.
where cells are struggling but still alive.
They're hanging on.
They're hanging on. Think of it like the outskirts of a wildfire.
Okay.
The fire hasn't reached there yet,
Right.
but it's in danger.
So there's like a window of opportunity to save those cells.
Exactly. It's a race against time.
Oh, wow.
With prompt treatment, we might be able to restore blood flow and rescue that tissue,
Okay.
but without it, those cells will eventually succumb.
This really highlights why recognizing those signs of a stroke quickly is so critical.
Absolutely crucial.
Is there a way for people to remember what to watch for, like a mnemonic or something?
Absolutely. There's a handy acronym,
Yeah.
BE FAST.
Okay, let's break that down. What does BE FAST stand for?
B is for balance.
Okay.
Sudden loss of balance or dizziness.
Okay.
P is for eyes.
Got it.
Sudden vision, changes in one or both eyes.
Okay.
F is for face.
Yeah.
Drooping on one side of the face.
Yeah.
A is for arms.
Okay.
Weakness or numbness, especially on one side.
Yeah.
S is for speech.
Mm-hmm.
Slurred speech. Difficulty finding words.
Mm-hmm.
And T is for time.
Okay.
Call emergency services immediately if any of these symptoms occur.
So be fast.
Be fast.
Got it. So even if you notice one of these signs, don't wait.
Don't wait.
Call for help right away.
Please do.
It's always better to be safe than sorry.
Absolutely.
Now let's talk about treatments. What can be done when someone is having a stroke?
So the goal is always to restore blood flow to the brain as quickly as possible.
Okay.
And the specific treatment really depends on the cause and the severity of the stroke.
Makes sense. What are some of the options?
Well, one of the most well-known treatments is a clot-busting drug called TPA,
Okay.
which stands for tissue plasminogen activator.
Wow.
It's given intravenously,
Okay.
but it has to be administered within a few hours of symptom onset.
So again, time is of the essence.
Really is.
Are there other treatment approaches?
Yeah, sometimes a procedure called mechanical thrombectomy is used,
Okay.
and this involves physically removing the clot from the brain using a special catheter.
Mm-hmm.
It's a very thin, flexible tube.
That sounds pretty advanced.
It is.
Are there other options as well?
Yes, in addition to addressing the immediate blockage, we also focus on preventing future strokes.
Right.
Medications like antiplatelet drugs and anticoagulants can help prevent new clots from forming.
Okay.
And in some cases, surgery might be an option to clear blockages in the arteries of the neck.
So it's a multifaceted approach.
And even when blood flow is restored,
Uh-huh.
there's still a chance of further damage.
Really?
Yeah, it's called reperfusion injury.
Okay.
It's kind of a paradox because as those revived cells start functioning again,
Right.
they can release substances that are actually harmful,
Oh, wow.
contributing to inflammation and cell death.
So it's almost like they're overcompensating.
Almost like that, yeah.
Wow. So stroke recovery isn't just about surviving that initial event.
Right.
It's about navigating this complex aftermath as well.
It really is, and rehabilitation plays a crucial role in that journey.
Okay.
Things like physical therapy, occupational therapy, and speech therapy
Right.
are essential for helping stroke survivors regain lost function and adapt to life after a stroke.
It's inspiring to see how much progress people can make with dedicated effort and the right support.
It really is. It's incredible.
Well, I think we've covered a lot of ground today.
I think so too.
We've learned what ischemic stroke is,
Right.
what causes it,
Mm-hmm.
the risk factors we can control,
Yeah.
what happens at the cellular level during a stroke,
Yeah, absolutely.
the importance of recognizing those early warning signs,
Yes.
and the different treatment options available.
It's been a pleasure diving into this topic with you.
Likewise.
Remember, knowledge is power when it comes to your health.
Mm-hmm.
Take steps to reduce your risk factors, know the signs of a stroke, and don't hesitate to call for help if you suspect something is wrong.
Yeah.
Every minute counts.
That's a message we can't stress enough.
Right.